Okay, I just realized a lot of doctors are a very egotistical bunch who regress into a reading comprehension of a 5-year-old when their authority is challenged. See, there's this radiographer on this app, by the way, go and support her, she's very nice, who just said if you book an x ray for someone to diagnose a single, simple, uncomplicated rib fracture, she will reject it, which is the correct opinion. And people went ballistic. Okay, the general public who don't know jack shit were saying a lot of bad things to her about her staying in her lane and whatnot. But then there were doctors, clinicians going like, "Oh, I've been a doctor for 15 years. If someone rejects my x-ray, there will be hell to pay." And loads of similar comments, treating her as if she's not somebody who does this day in and day out, works with doctors and radiologists all day long, may have an expert level of knowledge in what she's talking about, but also just digress to this low about talking about things in her trousers. Hot damn, y'all! Especially when what she's saying is technically correct. Even our guidelines, the RChem and the RCR, clearly state that rib fractures involve significant force. If you think somebody has a rib fracture and are worried, go for a CT instead. Because X-rays have up to a 50% failure rate in diagnosing rib fractures. And you should be more worried about the things underneath anyways. See, X-rays are calibrated to look at the lungs. Imagine going to a patient and going like, "Hey dude, so I think you may have a rib fracture. So I'm going to cook your inside on a test that fails 50% of the time." No, if we are worried, depending on how worried we are, we can get a chest X-ray to look at the lungs underneath. And if we're more worried, which technically we should be more often, get a CT scan.